are two steps of any cadaver dissection. The first is finding a structure. The second is cleaning that structure. To clean a structure, you remove the surrounding connective tissue, such as fat and fascia, so that the structure can be viewed clearly. You should never attempt to cut a structure without cleaning it first, or you will destroy other structures near to it or deep to it. To clean a muscle, you remove the covering fascia so that the direction of the muscle fibers can be viewed and the borders of the muscle can be seen. To clean a neurovascular structure, such as a nerve, artery, or vein, you remove the surrounding fat and fascia so the structure can be differentiated from other neurovascular structures clearly, and so that you can follow it to its origin and its destination. There are 4 tools that you will use in every dissection. The first tool is actually your hands. Neurovascular structures are often embedded in connective tissue. You use your fingers to palpate these structures to determine where they are before you use other tools. Muscles are also separated by layers of connective tissue. You can often slide your hands between them to separate different muscles, or to separate muscles from the superficial fat and fascia during skinning. Because you are using your hands to dissect, as well as using these other tools, you should make sure you have gloves that fit tightly without cutting off your circulation. You should perform frequent glove checks to make sure that the gloves have not been torn or cut. You should always bring multiple backup pairs of gloves to each lab. The second tool that you will use in every dissection is the forceps. These are good for moving structures around, for picking out small bits of fat or fascia, and for holding structures steady while you're cleaning with other tools. Forceps may be curved or straight, and they come in several varieties. These are smooth forceps. They still have ridges on the inside to prevent slippage. These forceps are good for manipulating neurovascular structures without shredding them. They're not great for holding skin out of the way while you're trying to clean other structures because they're likely to slip off. Smooth forceps may come in blunt and fine or sharp varieties. These blunt ones you'll be using most often, and these fine forceps are useful when you're working with very small structures, such as in the head and the neck. Your kit may also include rat tooth forceps. They're similar to the smooth forceps, except that they have these large teeth at the very tip. Rat tooth forceps are great for holding skin steady because they're less likely to slip off. Rat tooth forceps are not appropriate to use while you're cleaning nerves or arteries because they're likely to shred or to puncture these structures. The third tool that you're going to use in every dissection are the small scissors. Scissors are roughly the size of nail trimmers. They have short cutting length, and both ends come to a point. The small scissors are used not for cutting, but for what we call the reverse scissoring or the spreading technique. This technique is used to clean neurovascular structures without cutting them. To use the reverse scissor technique, if you have 2 structures next to each other, such as an artery and a nerve, you can insert the scissors closed in between them, open them up, then remove the scissors before you close them again. So it's never cutting, always just spreading these structures apart so that you can see them distinctly. You can also use this to clean fascia off the surface of arteries and nerves. Your fourth tool that you'll use in every dissection is the probe. Your kit may include both a blunt and a sharp probe. The sharp probe is almost never appropriate for use in cadaver dissection, as it will shred or puncture structures. But the blunt probe is quite useful for pulling fascia off structures, for manipulating structures, for holding structures out of the way while you're cleaning other structures. Here are some of the other tools in your kit that you use less frequently than those first sets of tools. First, you have your hemostat, which looks like a cross between a pair of scissors and a pair of forceps. They may be curved or may be straight, but all will have this locking mechanism near the grips. The edges will not be sharp, but will have ridges for good grip. This tool will be used primarily when skinning, because they'll allow you to lock on to a flap of skin and provide a lot of good grip while you're cutting with another tool or moving with your hands without giving you a lot of finger strain. Next, we have our large scissors. These will often have one blunt end and one sharp end. In cadaver dissection, you'll use the large scissors primarily when you're transecting muscles, so cutting across them so that you can reflect a muscle to either side. If you have a pair of scissors with a blunt end and a sharp end, the blunt end should always be deep when cutting so that you're less likely to puncture or cut or slice structures that are deep to the structure you actually want to cut. Finally, you have your scalpel. In cadaver dissection, the scalpel is used primarily during the skinning process. Skinning will blunt a scalpel blade very quickly, but that's useful because scalpels are also used to clean the superficial surface of muscles, so to scrape the fat off of those muscles. Scalpels may also be used to remove muscles from their attachments or to transect a muscle. When you're using a scalpel for this purpose, you should always use a guide, such as your probe or your kit may include a guide especially for this purpose. In either case, you insert your guide deep to the muscle that you're attempting to cut, and then press down along on top of it so that you're protecting the structures deep to the one you actually want to cut. You should never use a scalpel to clean neurovascular structures, as you will cut through or puncture them accidentally. When you're using a scalpel with your dominant hand, you should always use forceps or a hemostat with your non-dominant hand to hold structures steady. You should never hold tissue out of the way with your fingers because you will cut through your glove or cut your finger accidentally. Dissection kits may have either a number 4 handle or the smaller number 3 handle, or it may have both. Your kit should include appropriate blades for your scalpel handle size. The number 4 blade is larger and is more useful when skinning because it's more efficient. The number 3 blade, if you have one, can be useful for skinning structures that have a very thin underlying connective tissue layer, or if the area itself is very small, such as the palm of the hand. The blades themselves will come in a variety of shapes and sizes. A number 4 handle will only fit the blades in the 20s. So you can always check your blade size at the edge somewhere of your blade wrapping. You should be able to find a number. You may have to open it a small bit. You can see here this blade is a 21. So this blade size is appropriate for a number 4. The number 3 handle will fit blade sizes in the teens, so 10, 11, 12. To load your scalpel handle, you peel open the blade wrapping part way to expose the end of the scalpel. To load it properly, you line up the numbers so that they can be read on the same side. So I can see both 4 and 21, so that means my blade goes on like this. You can also check against the slanted edge of the handle and the slanted edge of the blade, as these are what create part of that locking mechanism. You'll notice that the blade itself has a space in the middle, and the handle has these grooves where the blade is loaded on. So to load your blade, you check that you line up properly. You slide the blade on, and as you meet resistance, you move to a firm surface and press down until you hear a click. You should never attempt to force the blade on with your fingers or remove the packaging before the blade is fully loaded. So now I have a fully loaded scalpel handle with a 21 blade. You should never attempt to remove a scalpel blade and save it in the wrapping for later because there's no way to secure that, and you're likely to have the blade fall out in your kit and create a hazard. To remove a blade from a handle once it's been used, you should never use your fingers. This is the secondary purpose of your hemostat. The hemostat's very good for this because, again, of that locking mechanism, as by the time you're ready to remove the blade from your handle, it's likely slick with the fat you've scraped off during skinning or cleaning. So to remove the blade, you grab the edge and lock your hemostat. You can see it's lifted up a little bit along the base. It's lifted up slightly off of that guide. Now I can gently slide it forward until the blade comes off. Once the blade's removed, it should immediately be placed in the appropriate sharps container. Each table has a bridge for your dissection group to use during dissection. This is not a step stool. The bridge is used to keep tools within reach without losing them on the cadaver or the body bag during dissection. Finally, there are some best practices for keeping your kit from becoming contaminated. The kit should never be placed on the cadaver, on the body bag, or on the bridge, as they will become contaminated with biohazardous material. Kits should be placed only on clean surfaces, such as the counters at the sides of the lab. Tools should always be washed thoroughly before you return them to your kit. Before dissection begins, you should pull the tools out that you think you'll need and place them on the bridge so that you don't need to change gloves just to grab new tools. As dissections are almost always bilateral, meaning they're happening on both the left and the right side of the cadaver simultaneously, your dissection group should have 2 of each tool prepared. So for every dissection, you should have pulled out your small scissors, a blunt probe, and smooth forceps. You should review your dissector before dissection begins to determine what other tools that you might need.